Hi everyone, welcome back to my channel. I'm Dr. Sana Ansari and today we are talking about something that literally every MRCOG Part 3 candidate asks. What station actually comes in the exam? So I have compiled the top most repeated stations based on recent recalls. We'll go one by one and I'll tell you why they keep appearing, how to answer them and the exact lines that score maximum marks. So let's start. Number 1 is on VBAC counselling. It comes every single time in some form. The scenario is patient wants normal delivery after previous cesarean. Now what you have to say? Absolutely. Let's go through your options so you can make an informed decision. Mention the success rate, which is 72 to 75%, the risk of rupture 1 in 200, continuous CTG monitoring, chances of emergency cesarean, benefits of future pregnancies. And end with, you are the decision maker. I am here to support you. Now the second station is on shortness of breath post cesarean, where we are suspecting pulmonary embolism. This is an important emergency recall. So the scenario is breathing difficulty after cesarean. Now what you have to do? Acknowledge, do the ABCD approach, suspect pulmonary embolism, start oxygen, IV access, inform your senior, arrange CT pulmonary angiography, start the therapeutic dose of low molecular weight heparin. Just say, I'm concerned you may have a blood clot. We are acting quickly to keep you safe. Now the third station is on reduced fetal movements. This is a constant favorite. You must appear calm, structured and reassured. Do CTG immediately. If there are risk factors present, do a growth scan with Dopplers. If everything is normal, reassure her and tell her if at any time you feel movements are less, please come immediately. Now the next station is on fetal growth restriction counseling. This also comes frequently, especially with Doppler abnormalities. Explain in simple words. Your baby is smaller than expected, so we are monitoring blood flow to make sure your baby is safe. Mention the umbilical artery Doppler, timing of delivery, steroids and magnesium sulfate if needed, when early delivery is recommended. Next station is on preterm labor or preterm premature rupture of membranes. This is a super common station. Confirm the diagnosis, explain risk associated with prematurity and leaking, explain steroids, tocolysis, magnesium sulfate, antibiotics if needed, timing of delivery, neonatal team involvement, and never forget emotional support, very important. Next station, very important, on hypertension and severe preeclampsia. So the scenario is patient comes with severe headache at 32 weeks. Now what all you should cover? Take blood pressure and urine for protein, magnesium sulfate, antihypertensives, blood test, planning the timing of delivery, explaining the risk of eclampsia. Now how do you have to say? We are treating this urgently because of your health and your baby's well-being. Now the next guideline is on early pregnancy with bleeding, where we suspect ectopic pregnancy. This one is also very common. Explain the findings on ultrasound, the treatment options of ectopic depending on her scenario, expected management, medical management or surgical management, NTD if required. Always show empathy. I'm really sorry. I know this is a difficult news for you. Now the next station is on postpartum sepsis. Sepsis comes again and again because examiners wants to see if you're safe. So say aloud, I want to check your temperature, pulse, blood pressure and do some blood test immediately. Take blood cultures, give IV antibiotics, fluids, check for retained products of conception, check baby arrangements since she is postnatal, breastfeeding and antibiotics. Coming to the next station on shoulder dystocia debrief. This is one of the most repeated counseling stations. The scenario is parents come and ask what happened during delivery. So you must explain in simple words, not medical jargons. Your baby's shoulder got temporarily stuck, but we used safe maneuvers to help deliver quickly. Cover what all happened, why it happened, risk of recurrence, documentation and follow-up. Do not use terms like medical error or blame midwife or staff. Now the next station is taking consent for cesarean, elective or emergency. So you have to explain clearly the indications, what happened in operation theatre, the risk associated with it, minor risk, major risk, bleeding, infection, venous thromboembolism, and injuries to bowel, bladder, anesthesia, skin to skin, future pregnancy implications. End with, is everything I explained clear so far? Now the next station is on postnatal contraception. Another frequent recall because it's quick and easy to test. Scenarios like breastfeeding women wants long-term method has risk factors of venous thromboembolism. So you don't have to mention combined OCPs. Explain progesterone only pills, implants, injectables, copper T, LNG IOS. When each of these options can be started and always tailored to her goals. Next station is on angry relative. It's an ethics station. Role player says, I have been waiting for 4 hours. So your job is to stay calm, acknowledge their feelings, apologize for their experience, explain, plan, offer to escalate to senior, and clarity in follow up. Use this line. Thank you for raising this. Let me see how we can resolve it quickly. So the most repeated stations based on recent recalls are VBAC, postnatal breathlessness or suspected pulmonary embolism, reduced fetal movements, fetal growth restriction, preterm labor or preterm premature rupture of membrane, hypertension, pre-eclampsia, ectopic counseling, postpartum sepsis, shoulder dystocia debrief, cesarean consent, postnatal contraception, and angry relative. If you master these, you will walk into the exam confident. Remember, stations are not about cramming guidelines. They are testing clarity, structure, empathy, safety, and teamwork. Use my 5 golden sentences. I understand your concern. Let me explain this in simple words. Here are your options. How do you feel about this? Let me summarize our plan. So this was all about the top stations asked in MRCOG Part 3. If you want me to create a full script on any of these stations, comment below. All the best for your MRCOG Part 3 journey.